kind of hopeless, right? It's a degenerative condition. There's nothing you can do besides take the pill. And thank goodness we know that, decades later, that is not true. But back then, that was the kind of prevailing thought. So in 1987, there was a woman who was named Lee Silverman with Parkinson's disease, and there was a Center for Parkinson's in Scottsdale, Arizona, named in her honor. She was alive and well at that time. And Dr. Lorraine Ramig, who is one of our co-founders of LSVT Global, she was a voice expert working at the University of Colorado and was brought in as an expert to really help develop some sort of speech treatment for these people with Parkinson's who would come to the center and stay there for a month. So it was very forward thinking. They were at that time, patients receiving multidisciplinary care 5 days a week, and but they didn't quite know what to do with the speech treatment. And so, anyways, she really started observing, working with people, and I won't say stumbled upon, she's very, very brilliant person, understood several different things. One of the things is if you keep it simple and focus on just being louder, there were other things that were happening, like facial expression, articulation, a whole range of cross system effects was happening with the simple cue of be loud. The second thing was it's okay to treat them intensively. They can not only handle it, but they need it. In that intensive, like working on effort of vocal amplitude and repetition of practice, was making their louder voices carry over from day to day. These people were actually getting better, which was thought to be not possible. And the third thing was a sensory deficit. If you have worked with or known many people with Parkinson's disease, the common phrase is, you need a hearing aid, right? Because people will always say, what did you say? I can't hear you. Can you repeat yourself? But the person with Parkinson's has a sensory mismatch. So they perceive that their voice is quite normal when in fact it's really soft. And when they speak in a more normal volume voice, it feels very loud to them. So it's a mismatch between what actually comes out and what they perceive. And so these three key principles were really amazing, and she decided to really pursue research her whole entire career and developed a treatment protocol that was named after Lee Silverman, called Lee Silverman Voice Treatment, because at that time it was all about improving voice in people with Parkinson's disease. So it was very effective. She and her research team put out several randomized control trials, and to date, it's the gold standard of speech treatment worldwide. It's the only speech treatment with level 1 evidence globally, and it's very well esteemed globally. Well, so that research was happening starting in the early 1990s, and then, fast forward going on as it was established. The thought was then, hey, could we apply these same principles to movement? And at that time, at the University of Arizona, Dr. Becky Farley, who a physical therapist, was studying at the same time as Dr. Cynthia Fox, a speech language pathologist, who is now our CEO of LSVT Global. And together they helped work on this translation of these key principles that were found to be efficacious for speech to movement. And that's now why we have two treatments, LSVT LOUD for the voice and a parallel sister treatment, LSVT BIG, focusing on movement. And that is delivered by physical therapists and occupational therapists who are certified in LSVT BIG. And then, at some point in time in the early 2000s, I believe it was, we formed a company. And the purpose of the company, LSVT Global, is to formally educate and train speech, physical, and occupational therapists globally in how to do the treatment correctly because it's not something you can just read from a paper. You really have to learn the principles, see how it's done, experience it yourself. And so we developed training and certification courses and now have trained somewhat over 40,000 clinicians in about 80 countries around the world since that time. And so it is a lot of clinicians, but there are many people living with Parkinson's disease and other neurological disorders that still are unreached. And so we still feel like we have big work to do, no pun intended.